Hello, colleagues, and welcome to our June 2022 ECHO Session. My name is Francis Ochen from the African Society for Laboratory Medicine, and I will be your moderator for today's session. Our session will run for 1 hour, and it will start with a presentation, and then I will follow it quick with questions, answers, and comments. Please join the discussions through our chat room for alternative questions, ideas, and comments that you may have. We do have translation services. Please keep to either the English or the French channel. And to get that, you get to the bottom of your screen if you're using a computer, and you'll find the icon of the globe, and you can choose French or English depending on the language you're most suitable with. Today's session is on laboratory results. And we know that lab results are critical in the diagnosis and monitoring of treatment. This value is derived when results get back to the right people, and by the right people, we are speaking to the providers of care, but also the recipients of care where applicable. And only when these results get back to them in a timely manner and they are utilized, then we can derive the utility from the lab results that are generated. In today's session, the Zimbabwe team will be sharing with us their experience in rolling out and the implementation of their results relay using the SMS, but also the electronic reporting. To support us with this discussion, we will have 3 presenters. Our first presenter will be Nora Sukutaivere, and Nora is the National HIV and TB lab program coordinator with the Ministry of Health and Child Care in Zimbabwe. Nora will be supported by Chideza Munguni, and Chideza is the Clinic Lab Interface Technical Lead with the Biomedical Research and Training Institute of Zimbabwe. And last but not least, our co-presenter will be also supporting the 2 is Mufaro Masama. Mufaro is the Laboratory Information Management Systems Technical Lead, again with the Biomedical Research and Training Institute of Zimbabwe. So colleagues, join me in welcoming our presenters, and I take this opportunity to hand it over to Nora and team to start it off for us. Thank you, and over to you, Nora and team.
All right, so I'm going to take you all through the Zimbabwe experience in the implementation of SMS for electronic results return on behalf of the team. The talking points are as follows: an overview, SMS electronic results return, SMS impact, and lessons learned. So the background behind the implementation of SMS for electronic results return was birthed in response to the COVID-19 pandemic. At that time, COVID testing was still being done centrally, with need to quickly communicate results in the face of delays, given the time lag in getting results to the facility, then to the patient. So COVID-19 result notification leveraged on the already existing laboratory information management system where this functionality was added. So this was a 2-way notification upon release or publication of the lab results, with automatic notification to both the health facility and the patient. So to the health facility, the COVID result would be sent and the name of the patient, also indicating the date of collection and the actual result. And to the patient, the SMS notification would actually notify them that the results are actually available for collection at a specific clinic. So it was round about that time that the lack clinic lab interface quality improvement project started in Zimbabwe to improve our viral load program outcomes. So during a bottleneck analysis, turnaround time was identified as an urgent issue that needed to be addressed. So this immediately became an opportunity for improvement. So during that time within the viral load program, the targeted total result TAT turnaround time was 28 days. And coupled with that, the proportion of results arriving at the facilities, the numbers were actually low. So it was during this period that SMS was first scaled up, and this was started at a high volume site with an ART cohort just over 6,000 to see how it would work at Mbare Polyclinic, an urban center in Harare. So from the outcomes of this pilot, timely result notification was realized. And from the viral load cascade, following demand creation, 6 days is the pre-analytic turnaround time, considering specimen collection and its transportation from the facility to the hub to the testing lab, where we're using an integrated sample transportation system. And then the lab testing turnaround time, intra-lab, 7 days. And with the advent of SMS result notification, the post-analytic turnaround time came down to 1 day from about 6 days. And this allowed timely result reporting and patient management. So it is in view of this that the national turnaround targets were reviewed downwards to 14 days. And this definitely has gone a long way in improving clinical management and patient outcomes. So this is just showing the milestones, the timeline on viral load EID SMS implementation. As mentioned, the pilot started in March 2021 at Mbare Polyclinic. From there, an SMS template was developed and reviewed with input from all stakeholders, and it went through the Ministry of Health and Child Care approvals through the Permanent Secretary's office, and it was ready for use. And it is at that time that telephone numbers started to come through for result notification, and the compilation started. So by April, 68 clinics were already receiving SMS result notifications. The numbers would be fed into the LIM system, the Lab Information Management System, and scale up intensified thereafter, such that at the end of October 2021, a total of 930 clinics were receiving SMS result notifications. And to date, continuous monitoring is ongoing, getting feedback from stakeholders through various platforms, because it's also important to ensure that the numbers, the facility numbers that are being used are correct, and that the notifications are actually arriving at the facilities to enable result utilization. So to date, we are at 974 facilities receiving SMS notifications. That's almost 60% of the targeted 1,672 facilities. So this has actually improved result utilization as the facilities are able to quickly update all their patient records. So how does the SMS result delivery system work? It sends SMS notifications to both the health facility and to the patient once the result is published from the lab information management system. So for a normal viral load result, less than 1,000 copies per mil, the facility will actually get a notification of the result, actually also indicating the date of sample collection and what the result is. And then from the patient SMS end, the patient is only notified that the results actually are available. And if the results are normal, they will go to the facility at their next scheduled visit. However, for critical results, where we're talking of high viral loads, the facility will get the notification and the name of the patient and the date of sample collection and the actual result, including the testing system, the testing platform that did the test. And already the facilities will also know that there is need to physically, make a call to the patient in case they have not seen the SMS. But for the patient that has actually consented to receiving the SMS, they will be told to go to the clinic in terms of the result, specimen date of collection. But the difference now is that the patient is prompted to go to the clinic for review as soon as possible. This is how these messages differ. So the patient will immediately go to the facility or at their earliest convenience. And then for circumstances around sample rejection, the facility will actually be notified that sample for so-and-so that was collected on a particular date was rejected and the result. In this example, it was a quality-related issue where the sample was too old for processing. So the facilities already know that a rebleed is required. And for the patient, they are also informed that they really need to go back to the facility for a rebleed, given the outcomes of the previous sample that was collected. So both the facility and the patient do receive notifications. So this is just a picture showing the Zimbabwe SMS electronic resulting picture, how the distribution has been in terms of SMS coverage across the country. So from the first pilot in 2021, yes, we are at 974 sites, currently receiving SMS support through several partners. And from this picture, we can see that there are certain areas that are green, and these have been privy to having partner support in those areas. And those are the areas where clinic lab interface, quality improvement initiatives first scaled up. But we also have the areas that are also in red, and that has been due to limited partner support. But however, anyway, the MOHCC has been working in these regions, and scale up of the clinic lab interface quality improvement projects is moving there. And we do anticipate to see a change in this picture as we go along and move forward. This is showing the electronic results return viral load SMSs from October 2020 to April 2022. When this started from the graph there around October 2020, we can see that it was just 952 SMSs, but with additional contact details that were being put into the LIMS system with additional procurement of gadgets, the number has been increasing. And as such, the number of SMS notifications drops when there are issues, say national reagent stockouts, because testing is interrupted and results will not go out as normal. And we can see an increase as testing resumed. And sometimes, well, there were like issues to do with SMS service portal that had a bit of issues that need to be addressed. But with increased addition of phones, we can see that the number of SMS notifications has been going up and down. Some numbers are being cleaned out, numbers no longer in use, and so forth. This slide is showing the number of SMSs sent out to patients. And those are the trends. Started off with 13,968 in October. And now that we're in April 2022, we're around 21,359.
Heads up, please hold on.
Sorry.
Thank you. Okay, so I was saying this slide is showing the number of SMSs that are sent to patients. There has been an increase when we compare the numbers from October 2021 and April 2022. However, you will notice that there is a gap between the health facility and patient notifications that you will see probably in the next slides. And this is mainly because of the consent process. So SMS notification to a patient is not automatic unless the patient has actually agreed to having to receiving these notifications, and this is done by agreeing, and this information is captured on the viral load request form. So not all patients understandably agree to this process of receiving SMS notifications due to confidentiality issues, as some patients may not have disclosed their condition and do not want to receive SMSs in case someone touches their phone. Some actually share phones with family members. And then other barriers are patients not actually having the phone. And then sometimes there are issues to do with poor mobile network connectivity challenges, particularly for patients in the rural areas. So the average SMSs sent to patients per day is indicated on this slide. It's been changing, but more or less ranging in an average of around 700 per day. Moving on to the next slide. The average SMSs sent per month per lab is actually being shown here. Those are viral load testing labs. And we can see that on average, 3,614 SMSs are being sent to the facilities that these labs offer testing support. To the right, we can see a case study of a facility, Chinamora Clinic, where tests done versus results sent via SMS is shown. And when this started in October 2021, the results sent via SMS were actually lower than the tests done. But over time, we can see that the gap is very close. The numbers are really close together between the tests done and the SMS results notifications that are going out. And this is due to good initiatives to ensure that the patients are empowered and are understanding the importance of such a notification. This slide is showing the proportion of rural urban facilities receiving SMS notification. where we are saying that from the 974 facilities, 85% of these are actually rural facilities, while 15% are urban facilities. This has been really that, the time lag that occurs in rural areas when you consider the distances, some of the terrains that need to be traveled to send out physical copies. The rural facilities were actually prioritized. And you'll find that with the rural, with the urban areas, due to close proximity and good road networks, you find that there are very frequent result delivery trips going on a daily basis. So 85% of these facilities are actually rural. So SMS per month, per lab versus the tests done, there are various trends. And we can actually see that there's a gap between number of samples tested compared to the results sent via SMSs. Some facilities do not actually have facility phones, and probably some of the areas are those ones that we saw in that national picture in red, and some of the issues to do with availability. And I think that is basically more or less the same picture, different dynamics in different areas owing to different trends, where in some instances, the number of tests done, well, most instances, the number of tests done really, it seems to be more than the result SMS notifications. But as we continue to scale up, we anticipate to see a change in the picture. So what has been the impact of SMS result notification? Like when we compare with the paper-based post-analytic turnaround time, we can see the different post-analytic turnaround times from the various viral load testing labs there. However, the moment the SMS comes into the picture, we can see that it is really a game changer, reducing the post-analytic turnaround time to 1 day. So how does the electronic result return via SMS work? So whilst the facilities were given the gadgets or the phones with which to receive SMS result notification, it was not just a matter of just giving them the gadgets and leaving it at that. A lot of on-job training support was given and offered to the various clinic lab interface facilities. And to augment those efforts, a job aid was developed, and this job aid was meant to really standardize electronic result handling. And then you find that from the patient side, health education was being done to ensure that the patient consent process is improved, that the patient is actually empowered on the importance of going through the consent process. So this job aid is showing how the electronic result returned via SMS works, where the results being electronic are not limited to SMSs for facilities. They can also be emails, where some facilities actually prefer emails, particularly the high volume sites. They may actually prefer emails, and these are sent, the results are sent in the form of password protected Excel sheets. So that is the process there. Once the result is published in the lab information system, the facility immediately receives a notification, and the different kinds of notifications, whereby if it's a rejection, the client is followed up for a rebleed, or the notification just comes and, critical result as mentioned below, or And then once the notification comes, the result is updated in the patient health records. It could be a physical green book or an electronic medical record. And this has allowed timely result utilization. So SMS result availability also goes to the patient, and the patient will either be informed of result availability or the need to go for a rebleed. So the SMS result notification does not take away the need for hard copies. These hard copies are still received by the facilities, and they are filed in the patient green books, and these come through the integrated sample transportation system in Zimbabwe. So what are the recommendations that we have given the experiences from everything that has been discussed? There are technical aspects for consideration, which include the need for customization of the local lab information system, the electronic medical record or the electronic health record, to be able to support the SMS functionality so that these systems are interoperable. It's also really key to select an SMS service provider that will be able to give a good coverage in most of the areas, that is reliable and that is cost effective to bring down the costs. It's also important to ensure that there's that integration of the LIS, EMR or EHR with an SMS service provider that will actually be able to support all these functions and ensure timely result delivery. Other technical cost drivers to consider would be the cost for customizing the local system. I mean, it really depends with the situation on how much customization may be needed, but that customization aspect is something that may need to be considered. When it comes to costing, we have found that bulk service SMSs are actually cheaper. So it's actually important to be able to negotiate such to ensure that cost savings and efficiencies are realized. And then there's also need to really support the staff managing the SMS directory, and to also ensure that the staff, the support is offered to the lab information system or the electronic medical record or the electronic health record system. We actually have learned some lessons as well from the implementation of this. When it comes to result notification, it's really critical to have a facility gadget in terms of a phone or a tablet, because that is where these results are going to be received as they're churned out from the lab. And there is real need to strengthen our utilization of these results by the requesting clinicians. They need to be aware that what to do when these results are received on through SMS notification. So it's really important that these results are utilized. So the SMS consent inbuilt in that is inbuilt in the viral load request form is actually has been actually helpful, because it is at the interface between the patient and the clinician that consent is asked for, following explanations and discussions on the importance. And once the patient agrees, that is the point at which the phone number is captured. So high volume facilities, has already been mentioned, usually prefer email configurations, and this needs data support. So moving to the client side of notifications, the rebleed notifications have been found to reduce client return time for specimen recollection. because they get the SMS promptly. And this actually improves high viral load patient management processes, and they can already start the EAC sessions quickly. And then client education is really key. It is really important that our patients are empowered, and they have their viral load literacy is improved, and they get to understand the SMS function. So this is something that's continues to be done, and we found that it is key in getting more consents from the patients. Client feedback collection also enables improvements, because as we discuss with the clients, we also, we really understand where else we can actually improve. So that feedback is very important, and Zimbabwe is looking at exploring options of SMS in vernacular languages, so as to cater for all the different kinds of patients who may prefer to get notifications in a preferred language that they understand better. So all this would not have been possible without the collaborative efforts from other stakeholders, the tremendous support from the Ministry of Health and Child Care, as well as PEPFAR support. Thank you. This brings me to the end of my presentation. Back to you, Chair.
Thank you very much, Nora and team. A very clear presentation, quite informative and exciting. You've taken us through and demonstrated how we can take advantage of actually challenging situations, COVID-19, for example, and turn the learning from that into something that can improve our healthcare system. You've also broken down the turnaround times from pre-collection to collection through to results dispatch, and the demonstration that what you've come out with actually reduces the turnaround time significantly. And I guess you continue to learn from that and improve this. But also how it works, how the messages are sent out, who gets the messages, but then also the form in which the messages are sent out. Thank you very much again. Now we will move to the questions and answer sessions. Again, let me thank very much your team. Levi and Mufaru, you've been supporting with answering some of the questions in real time in the chat room. But we'll take some of those that we may need to again throw more light on. And I will start with a question that is combined from Makombe, Bernard, and Peter Niwagaba, and I will try to combine this. The three are asking, are the SMSs sent through intermediate facilities in your lab network, or it is sent directly from the testing labs to the facilities? And in what languages, and who bears the cost? Nora, if you could take that. Nora, if you can't hear me, then, okay, please go on. Thank you.
Thank you, Francis. So the SMSs are available in the two most common vernacular languages that we have in Zimbabwe. And the cost of sending the SMS is it's paid for centrally through the LIMS, and we have different partners supporting that. So the patient or the clinic doesn't bear the cost. It's a separate cost item that is included as part of the lab services costs. I hope I have answered you clearly.
Yes, and just one follow-up question on that, because we do know that there are patients who are minors and they are caregivers that support. I mean, yes, caregivers. And so do the messages sometimes also are directed to caregivers other than the direct patients, or it is strictly going to the facility and patients only?
At the moment, the message will go to the patient and the facility, unless if the patient during the consent process has opted to give the phone number for the caregiver instead. But we are capturing one phone number for the patient at the moment. So usually it's the patient, unless if they have opted to give another number, which is not their number.
Thank you very much, Nora. And there is a question on appointment management. And this is key, because then those who have critical results, like you've indicated, are asked to come as soon as it is possible from their side. And then those that do not have very critical results are asked to wait for their appointments. Are you seeing this disorganizing the appointment management of the facility? You're therefore moving some patients and then overloading the patient, the clinic some days, and then some days are lighter because of that management of appointment that is now based on results that we are seeing.
Thank you, Francis. At the moment, no, I wouldn't say it's disrupting the booking system at the facilities. So before the SMS system was introduced, the facilities were supposed to call patients with high viral load results anyway to come back to the facility as soon as possible. So introduction of the SMS has just made the work for the facilities a little bit easier, because now there is another prompt that is going directly to the patients. So the clinic will now have to follow up on the patients maybe that didn't consent to an SMS and that do not get the SMS to then come to the clinic for management of high viral load. Also, in terms of the numbers of patients that will need to come back for management of high viral load results, it's not a lot of our patients. Currently, our viral load suppression is around 94%, so it's only about 6% of those patients that will need to come back earlier to the facility for management of high viral load results. So just to say thank you to Chieza, she's the one who actually presented Francis. I know she is soft-spoken like me, maybe our voices sound similar, but I didn't make the presentation.
Oh, thank you so much for that. I didn't realize that. Surely, my sincere apologies. I hope that she will find some space and forgive me for that. Now, the quick question that is coming is that we know from Thambo, we know that we have multiple service providers in terms of telecommunication network. And I guess it is not an exception in Zimbabwe. And so do you send messages through all the network, the telephone providers in the country, or are we using only one provider? And if yes, what was the criteria for choosing the provider that we're currently using?
Thank you, Francis. So maybe I can take this one. So what we're using is an SMS gateway. So what this SMS gateway does is that based on the number which has been sent, it then identifies the mobile network channel that it's supposed to use. And so it automatically redirects from its point to the number based on the mobile service provider which has been provided. So it's not more of a particular service provider, but it actually uses a combination of those service providers as a gateway to be able to send those SMSs through. Thank you.
Thank you very much, Mofaro. Thank you again. So we have a question coming in from Abbas. And Abbas is asking, this is related to the regulations in the country that relates to sharing information, individual information broadly. So he is asking, do you have any local government regulation that you had to contend with in terms of confidentiality, and how were you able to navigate around this?
Hi, Francis. Sorry, I didn't quite get that question.
Okay, so I can repeat it, and any one of you can take it. So the question is related to confidentiality and some of the policy and legal environment in your country. And this is coming in from Abbas, and he's asking, do you have any local government regulation that you had to contend with in terms of confidentiality? And if yes, how were you able to go around this?
Thank you. So the short answer is no, we don't have any local government regulations that we had to go through to enable this system to be launched. What we are working with are the health regulations in terms of maintaining patient confidentiality. So in terms of the operations themselves, to us, it was just changing the medium of communication or extending the medium of communication that we have been using from the paper-based result to an SMS result. The gadgets or the phones that we are using for communicating these results are specific for that facility, and they stay in the OI department. So the staff that are working in the OI department, the nurses or doctors, are the ones that have access to those SMS results that are coming through on the phone. So in terms of confidentiality, it still remains within the people or the staff, healthcare workers that are handling the patient information and confidential data. So we haven't extended the group of staff, as it were, who have access to those records.
Nora, let me bring back this, and again, my apologies for misidentifying you. But I have a quick question coming in from Alan. And Alan is saying, do the notifications account for patients that can't read? Or do you have notifications that are graphic and can support those that cannot read? Or those then fall under the categories that do not consent for these services?
Okay, so currently what we just have are text-based SMSs. We actually don't currently support the graphical type of result at the moment. Thank you, Francis. Over.
Okay, so I have a general question from Michael, and Michael is asking that if you were to advise countries that may want to take on this initiative, what are some of the key considerations that they would have to focus on as they take on the initiative based on the learning that you've had from your piloting and rollout?
So for countries that are looking to rolling this out, they would need to consider issues around facility support in terms of the gadgets. They would need to ensure that training is given to the clinicians that will be handling the electronic results notifications. It's also important that probably guides and protocols are also put in place to ensure that they standardized practice. And then for the patient side, it's important for the patient to understand the importance of receiving such notifications. So that means that health education needs to be done to improve viral load literacy of the patients. And I think, as alluded to earlier, there would be need to ensure that some technical considerations are looked into in terms of which service provider to choose, one that is that has better coverage, that has lower cost and reliable, and the interoperability of any electronic health record systems with the SMS functionality. So once that happens, something can actually be established. So it's actually important, first of all, to really do it a small interfaced approach, whereby you learn lessons and probably adopt best practices for scaling up elsewhere, because each context is different, and as you pilot, you actually learn things and see how to improve. And as the process has been ongoing, there's really a need for continuous collaboration between stakeholders to ensure that the right SMS numbers that are within the lab information management system are correct, that they are working, that the feedback is happening. So it's really important to keep strengthening the clinic lab interface aspect to ensure that the whole system is working, and this is really done collaboratively with the LIMS department. Thank you.
Thank you. Thank you again, our very good presenter for the day. Now, I think the second, we'll pick a few. There are quite many questions coming through, but I'm also happy that most of them have been answered through the chat room. But just to re-clarify again, on the cost aspect, we do know that patients are not bearing any cost. But for countries that may want to take this on, somebody will have to bear that cost, whether it is the donors that are supporting them or the government directly. Do you have a rough idea of how much it costs to send one SMS? The question keeps coming in the chat.
Hi, Francis. So for us locally in Zimbabwe, the cost for sending a single SMS is 3 United States dollars cents. So 3 cents per SMS.
Okay. Thank you. Thank you very much, Mufaro, for this. And I will take one more question, and the question is coming in from a colleague. I can't quickly get him. And the question is related to the testing labs. And Zimbabwe might be zoned into provinces or counties. I again apologize for misnaming your zones in the country if they are not called provinces or counties. But do you have testing labs in all corners of the country to support different catchment areas? And are those labs the ones sending out the SMSs, or this is being sent from a central server in one lab that supports the other different testing labs?
Maybe if you could come again on the last part to do with the server. I didn't quite understand that part.
Okay, so just to try and understand the sending out, because you might have multiple testing labs in the country in different locations. And so are the SMSs that are going to the facilities that are referring samples, and then the patients whose samples are taken, are those SMSs being generated from each of those multiple testing labs, or it's being generated from a central server somewhere in one bigger testing lab that is supporting the different testing labs?
So the SMS is being generated from the individual LIMS instances, which are found in the different labs. And transmitted to the single SMS gates of the SMSs.
Thank you very much again. And as we come to the end of today's session, again, a very exciting and informative session. I know that we will have multiple questions coming through for those who may want to take this from multiple countries. And we hope that you will also be available to support with guiding as and when required. Now, I will just ask that we do the closing remarks from the different presenters, co-presenters, and I will start with our very wonderful presenter of the day, Chideza. Your closing remarks.
Thank you so much, Francis. Thank you to everyone for taking time to attend this very important presentation and allowing Zimbabwe to share experiences. Unfortunately, the time was short, but we are available to answer further questions, and we're looking forward to hearing from you. Thank you.
Thank you very much. And Nora, your closing remarks.
Thank you very much, Francis, and thank you everyone for participating in this call and for giving us the opportunity to share our experiences with the SMS results. We have shared our experiences and we have also learned a few things from the questions that were coming in that will help us to also improve the system as we move forward. Thank you very much.
Thank you, Nora. And finally, Mufaro, your closing remarks.
Thank you. For further assistance for other countries who are also looking to achieve us.
Thank you, Mufaro. I don't know whether it is my network or yours, but thank you again, team, for a very informative session. And I hope that colleagues who've joined in have learned a thing or two, and it can support the initiative should they choose to go this direction. Thank you again for being with us for the last 55 or so minutes. We had some questions on sharing the materials. The materials will be available on our online resource center, and my colleague Anafi shared the link. We will also make available the resource materials through your email for those who registered when they were registering for the session. We'll have the materials sent to you on mail in 2 or 3 days when everything is sorted on our side. Again, from me and everyone else, we totally appreciate your participation. And if you want to access your certificate to demonstrate attendance of this session, we already have the certificate code on the screen, and you can easily also get that. Until our next session, from me and everyone else from ASLM, we wish you a good day, good evening, and good night for those who are closing their day. Thank you so much, and over from us.